tour videos, and I make food videos, whatever comes my way, because I'm a wellness nurse coach, and I'm an ER nurse if I'm not coaching. And today I am making a mature video regarding um, hormone replacement, regarding menopause. That's where I am today. So I'm not cooking today. I want to talk to women out there who are suffering. This is a vulnerable video, and I would like to share with other women. I know I'm not the only one who is suffering through this journey, change, body changing, body shaming. I still want to live a life, but yeah, I have this issue that has dented into my life at the moment, and I know I'm not the only one who is facing this issue, and I want to have a discussion and see if anybody has some insights for me, because this I do not have an answer to. So this journey started in 2023. I started taking my replacement and compounded estradiol and progesterone, and that's the only thing I take because I live a pretty healthy life, and that went well. And until last year, I was looking at my blood serum as a nurse, and I would notice that I don't see my hormones coming into the bloodstream. And since that's not my area, I filed that in my back of my head. But I was thinking that my providers are looking out for me, which turned out to be not true. And a year ago in February, I started having night sweats. And in those 2 years I was taking my hormones, everything was fine. I wasn't having any uh, night sweats or hot flashes. And those hot flashes come especially when I'm in the emergency room and I have a stressful situation. I would have them. So I know the hormones have really worked for me. I know this is a touchy subject, but for me it worked because my knees started working again. I was really having trouble walking up the stairs, and I'm not that old, and I go to the gym and I do lift, and I was having body pains, not sleeping well, just not feeling like myself. And I decided I'd rather have a good quality of life. I don't have any breast cancer history, so I decided this is what I was gonna do, was take replacement. And I do know that people don't like hormone replacement, but that's my journey. I always talk about my journey because I know that there's somebody else there who's suffering, or we can exchange ideas. That's why I'm here. So this February, I called my provider and told them I couldn't sleep anymore. I cannot afford not to sleep while I work 12 and a half hours. I mean, I'm up for 16 hours. And what happens is I need to be alert and awake to be able to do my job. And if I'm awake all night long because of this one issue, while I'm still taking medications, which is pretty expensive, the compounded estradiol does not get covered by the insurance. So yeah, I needed something to happen. I called them, they went to see me, they looked at my labs and they told me, yeah, you haven't been absorbing your estradiol for a while. And I was kind of disappointed because I thought when they ordered this panel, they check it out. I failed myself as a nurse. I'm always advocating for other people, but I had no idea I needed to do this um, for other, for myself. Unfortunately, I had to fire this provider. Went to a functional medicine, and I told him what was happening, and he did blood work that actually saved me from being diabetic, because as you get older, as you get to the menopause area, your cholesterol changes, your body changes, your hormones are all over the place. They're trying to stabilize themselves. Anyway, so I was glad to go to this uh, provider, and he did send me to a different compounding pharmacy, got me some different medication, and I've been taking, but I'm still having hot flashes. But the main thing is I have been having heavy bleeding since August. and we cannot find out what's going on. I do have fibroids. Actually, this is why I'm here. I'm having some fibroids issue. And hi everybody, I can see you, I just can't type. And but hi and thanks for being here. I appreciate whoever is here. Joanne, Tourette, Annabella, thanks for being here with me, and I appreciate your presence. So anyway, all my adult being an adult, have had these fibroids, and they've never been a problem until I started taking hormone replacement. And so I have no idea. Every month I'm having bleeding every month, like twice a constantly. I'm doing it, which I shouldn't be because I'm in menopause. So I went and did an ultrasound, and it seems like my fibroids are getting bigger and bigger. As soon as I stopped taking the HRT, the replacement hormones, I stopped bleeding. I went and saw a different provider because they were talking about hysterectomy, which I know it's a money maker in America. I do not want to do that. And so, but I went because I'm being, and I asked them what less invasive procedure can we do? And they told me I need to get a hysteroscopy and myomectomy. These are just simple words saying it was a DNC to remove my fibroids so I could stop bleeding. So they went in my uterus and shaved all my uterus, the fibroids they could see, took the sample tissue. I haven't had a follow-up appointment yet. And right before I did the procedure, because I knew they were going to place an IUD with progesterone into my uterus, which they say it's good for me so that it can protect my uterus from shedding, because that's how you get cancer. They did that. I started back on my hormones, and so that first week I was bleeding from the surgery, and then the second week I stopped. Then this week I started again, heavy, same as I was before, cramping in my lower abdomen, and nothing is relieving it. So I called them. The surgeon says that's normal. That's what he thinks, but I need to go have an appointment, which I have this week sometimes. But today I was talking to a friend who recommended me to go and see a Chinese medicine doctor who uses herbs, and see whether that can help me from bleeding, because I still want to take my hormones, because I know they're protective. They protect us from getting strokes, osteoporosis. They are good if you're able to take them, and I would rather have a short quality of life than prolonged suffering of life that is not quality to me. So I don't have a problem taking that, but I do understand some people have a problem taking that, and I can see the difference between when I take them and when I don't take them. So yeah, I'm just wondering how many people out there, how many women do have this issue, what have they discovered. And yeah, despite they took several of those fibroids, they cut them out, they put that IUD there, and yeah, I feel like nothing was done this week. Feel like it was just a taste of the procedure, because I think you don't go and get a procedure and come back with the same problem, feeling the same way you were, that I have to keep taking Tylenol, ibuprofen for the pain. It doesn't make sense to me. Yeah, so is there anybody who might be having this issue? Anybody who knows about hormone replacement? Anybody who, it is, unfortunately, women, when we get to a certain age, we are, when you're having babies, that age of childbearing, that's very important. They have done so many, research, they give us money for that. But once you start getting older, people just, the government, they don't have research for menopause and premenopause. We are still your sisters. We are still your your wives, we are still your brother, your aunties, and suffering every single day. How does that benefit anybody? But I understand it's a patriotic world, and we always left behind, but we have to advocate for ourselves, and this is why I'm here. And yeah, if there's anybody who might have some insights, but yeah, like I said, I'm trying to see a Chinese medicine. They will try and get me a try Chinese medicine, because I know that they are pushing me to do a hysterectomy because it's a money maker. Everything about healthcare in America is about making money. If they're not making money, why would they want us to be well if they're not making money? Nobody wants that to happen, because they make money when I go to the hospital and I'm there for 2 days and however long you go there and you're taking medication. And I am in healthcare and I love helping in healthcare, but the only healthcare that I believe is emergency medicine. When you're in trauma, we do a good job on that one. When you come with a heart attack and stroke, we are on it. Yeah, that will fix. But anything chronic moving forward, it's just for money making. That's my thing, and that's what I've seen with my own eyes. And as I get older, I'm getting skeptical more and more, and that's why when on in my channel you'll always see me say wellness health starts in your kitchen, not in the hospital. So anyway, yeah, this journey has been really frustrating for me. And the same provider that I'm talking about, that one I thought they were looking out for me, it was a family practice. The mom was the person who had 30 years of dealing with hormones. She's the one who was supposed to be looking out for my blood work. That did not happen, and I failed myself also. That's why you always have to um, have somebody or advocate for yourself. And so that provider, when I went to see her, the mom had retired. When I told her I'm having night sweats and what have you, she told me, "Oh, maybe you do have maybe you have leukemia." And for crying out loud, I said, "What do you mean I have leukemia?" We went from night sweats to leukemia, and I said that was not in my radar. So I said, "Hey, if I have leukemia, what are the symptoms?" She goes, "Oh, weight loss." That I said, "None of that is happening. I have gained so much weight trying to balance my hormones, so I do not have leukemia." And again, in a few years ago, she had sent me to a different doctor to get a biopsy, which she wasn't even transparent, because she knows I'm a nurse and I would always question her. She just told me to go to see this other OBGYN, because she was not able to do whatever she wanted to do. And before I get there, they call me to say, "Hey, you're getting a biopsy and your copay is $400. I said, "Biopsy for what?" She goes, "Oh, that's what the doctor sent you a referral for." I'm like, "I'm not having any biopsy. I don't have any issues." So when I went to talk to the doctor, I told her, yeah, this OBGYN, I told her, yes, I was having some bleeding. This has been ongoing for quite a while now I think about it. And she looked at me, she looked at my lab, she said, "I don't think there was anything to be worried about, to be doing biopsy." So I've become very skeptical about the healthcare that we are receiving lately. So that's why I'm here, seeing whether there's anybody else suffering with this issue. Is there anything we can discuss about? Is there any way we can help each other? Because women, we need to help each other. We are our own advocate, and we have to advocate for each other. I do that every single day in the hospital. I do advocate for everybody, but as I get older, I am more aware of what's getting on. As soon as you hit 50, things start falling apart. Then yeah, it's not the best. So anyway, this is what I was here. That's what is in my heart, and I was hoping anybody might have some insights somebody who might know anything about Chinese medicine. I have no idea of how Chinese medicine works. I know they use herbs, and I am a firm believer of using food as health and wellness. Herbs, I've never had any issue with my health before, so I do not know how that works, but I'm willing to try. So if there's any menopause doctor out there, somebody who's specialized with HRT and fibroids, let me know if I can continue taking my HRT, because every time I take them, I have this fibroid bleeding, and even if they are taken out, I'm still having issues. Please let me know if you have any insights for me. Sometimes we don't always have solutions for ourselves, and that's why we come to them, mass media. That's why we come and talk to you and ask if you have any insights, any help, because we are human beings, and this is a journey we all, unless you're a man, as a woman, we are gonna go through this. And yeah, and like I've said, talking about menopause and women's issue, it's something still in the closet, something that nobody talks about. It's still indignified. It's something that we should just talk behind our backs and not talk about it. And that's why we can help each other. I keep talking about my own family, that I have older sisters. I'm the youngest. I do not know their menopause journey because it's something that nobody discussed. Yet women, we all have to go through this journey no matter what. We are not coming out of this alive, but why don't we help each other? I will never understand why we don't help each other through this journey, so that whatever, you can tell me something you did that, or some herbs you took that helped with this and that, because I believe in the power of people. I believe in the power of herbs and alternative healing. If this that's just my thought about this. Anyway, those who do not know me, again, my name is Mercy. I'm a wellness nurse coach and a holistic nurse. And when I'm not doing this, when I'm not cooking, you can see in my channel I do cook, and I do talk about how to make our lives, how to improve our lives, because I like to improve lives as much as you can, so that you can have a good mental health. I know, like right now, my mental health is really not doing so well, because I haven't been sleeping for a while, and I need my beauty sleep so that I can take care of you. So if there's a doctor out there who can help me with fibroids and HRT, I'll be happy to hear what you have to say. And yeah, thanks for anybody who joined me. Somebody who's not creepy about touch my face. That's this is a health and wellness channel, and talking to women who are suffering. It's a serious issue, and yeah, I'm sorry that I disappointed you, but this is what this is about. Have a wonderful night, whatever you're watching from. Have a wonderful day, and please comment, subscribe, give me a thumbs up. Let me know that you hear me. Let me know that you enjoy my content. If it's helpful. Today I did not have any answers for you. I'm seeking answers. That's why I'm here. And yeah, thanks for watching. I'll see you in my next one. My next one will be uplifting. I'll be cooking something. I'll be sharing about foods that might help us feel better. And thank you for those people who are sending love. And yeah, women, let's stand strong. Let's help each other. Let's make this a normal journey. It's not abnormal. It's part of us getting old, and let's not be ashamed. I'm not ashamed anymore, because I'm still here. I'm still standing. Good to see you. See you in my next video. Please don't forget to subscribe, comment, give me a thumbs up, and come back again. Thanks.